Thank you, Janelle, for being here. Could you please tell us a little bit about yourself and your role and what you're educating us on today?
Yes, thank you so much, Becky and Stephanie. I am Janelle Mendelson. I work at the VA here in Aurora, Colorado, Eastern Healthcare System, and I'm with Public Affairs. I'm the outreach coordinator. So today I'm just going to do a quick overview, hopefully with the PACT Act, which came into being last August of 2022. May I share my screen to do a PowerPoint?
Yes, and if that doesn't work, let me make you co-host to make sure.
Okay.
Go ahead and try.
Okay.
See. Yay.
And you see, and it should be, again, over here, all things PACT Act 101.
It's working.
It's working. Okay, yay. So let me go down to screen 2. Basically, the PACT Act, it was the Sergeant First Class Heath Robinson promise to address comprehensive toxins. So that's where the PACT comes from, Act of 2022. This was a new law that expands VA healthcare and benefits for veterans that were exposed to burn pits and other toxic substances. I did share this with Stephanie, and I know she said she was going to send it out to all, so I won't try to just bore you with word for word here. So kind of keep going through. Basically, it extends eligibility for VA healthcare for veterans with toxic exposures. Key point here is veterans for the Vietnam era, Gulf War era, and the post 9/11 era. It's going to hopefully get some presumptive statuses in place that will help the VA to improve decision-making processes. The key point here is, and I will add a little bit more to this here a little later, is that every enrolled veteran will receive an initial toxic exposure screening and a follow-up screening every 5 years. They did start doing this at primary care visits, I believe back in November of 2022. But we do know that some veterans have been missed and or are not even aware of this. So again, give you a little more information on that. Healthcare staff, claims processes, again, are going to receive the toxic exposure screening, education, and training. We have been doing a lot of that recently. The key was initially, and it probably states this on another slide, is that if you did an initial intent to file for a claim, you'd have a year going forward. As long as you did that by August 9th of this last month, the claim, if there was anything that would be put forward or fulfilled, would have been back to August 10th of 2022. But it's still going forward. So let me continue with that because we still want to get everybody doing their intent to file and claiming. Basically, it requires some research studies on the morality of veterans who served in Southwest Asia during the Gulf War, post 9/11, veteran health trends, and the veteran cancer rates. Go forward to screen here. This is basically where some the veterans where they served, they did add to this. If you kind of see at the bottom down here, I kind of put my little arrow or cross here. Being exposed to air pollutants, obviously it was the burn pits, the oil well fires, sulfur fires, sand dust, and particulates. Chemicals, here's where for veteran Vietnam era veterans, it was Agent Orange or other herbicides, pesticides, and depleted uranium. So that's key there. Again, some occupational hazards, radiation, warfare agents. So they did add some of these in as presumptive. And that is really some of the biggest things about this is why it's become such a big deal as far as the PACT Act and getting people screened and seeing where they're at. Again, this is Gulf War era post 9/11 eligibility. It's talking about if you served after August 2nd of 1990, following these countries. If you were in or these countries are after September 11th of 2001, again, they added some countries to this. New radiation. I would say that probably the dates are the key points on this slide. If people were doing cleanup at the Inwantak Atoll, I'm not sure if I'm pronouncing that right, January 1st through 1977 through December of 1980. And then again over in Spain, January of 1966 through March of 1967. And then any of the Air Force B-52 bomber carrying nuclear weapons in Greenland. Again, they're looking at January 21st, 1968 to September 25th, 1968. So again, it goes back to specific dates, but those are things that you might want to bring attention to people that served during that time and in those areas. Here also is the probably a very important slide, number 7. It's conditions presumed to be service connected. And they did add in new conditions. These are things that definitely you want to have veterans take a look at. They might have put a claim in previously and were denied. They definitely want to do a second claim to this. Again, a little more information to follow on that, but very important to kind of review this and see if there's anything that they might have that they could again look at. Veterans for healthcare enrollment who served in the following locations and time periods can enroll in VA healthcare now. Again, this is really important to look at what dates. So the Republic of Vietnam between January 9th of 1962 and May 7th of 1975. Again, some of these other countries either have been added into or dates have been extended on that. Again, Vietnam era veterans are now able to apply for 2 new Agent Orange presumptive conditions. This has been huge in things that I've talked to some different veterans about. Basically, the one that I can pronounce here, I'm sorry, is high blood pressure. But definitely you want to make sure that you're looking into anything that goes back to Agent Orange, which would have been a presumptive condition. Key thing here, if you have anybody that was in post 9/11 combat who separated or were discharged between September 11th of 2001 and October 1st of 2013, that enrollment is free. There are no annual costs and care may be free as well. So that again is a very important time frame, but it's the special enrollment period for healthcare. It's now open October 1st of 2022 through, and this is a key point, through the end of this month, September 30th on that. So again, if you have anyone in that time period, as far as not having had health care through the VA, this is something that's a very important time period for special enrollment for them. Healthcare enrollment eligibility. Who, of course, all veterans enrolled in VA healthcare. What it is, it's basically 5 to 10 minutes, series of questions to identify and document any potential exposures to toxins during military service. When at least once every 5 years, can take place at the medical center and or clinic. It's supporting the veteran long-term health plan, and of course the informed whole health care. Ask about the screening at their next VA appointment. Again, this was started with primary back in November of 2022. I'm not sure if all primary care were recognizing that at that time, and or some veterans might have been given this quick what we call toxic exposure screening, but didn't realize that was what it was. So they definitely want to ask for and make sure that their doctor has that documented and it is in their file. So filing claims. Again, you can file a claim for the new presumptive conditions. Again, going back to what we saw on 7. A new claim, and they've never filed one before. So they definitely want to look at those and say, hey, this is something that maybe I need to look at and see if I can do something. So filing a claim. The supplemental claim, that means that maybe, again, the presumptive condition was previously denied because it was not on a list before. It's now considered to be presumptive. So they definitely want that supplemental claim. This is a key point. If the VA denied one of the new preceptive conditions in the past, but the veteran may now be eligible for the benefits, the VA will try to contact them. Now that's a good one because things might have changed since maybe they'd filed one. Numbers have changed, addresses have changed, so forth. They do try to keep contact, good lists, but I'm just saying that, go ahead and they're saying there's no need to wait to file a supplemental claim. I would suggest anyone that feels like that they have those that you run into, go ahead and call the VBA and get that going. More information where they can do that. Absolutely prioritizing the claims of veterans with cancer to make sure they get timely access to the care and benefits they need. Pending claims. If a veteran's condition was added to the list of preceptive conditions after the file or after the claim was filed, VA will consider it on a preceptive basis. So again, they're looking back at that and looking at those claims. Let's see. Key point down here, preceptive conditions do not require proof that the military service caused the condition. Veterans only need to meet the service requirements and have a current diagnosis of the preceptive conditions. Veterans should submit any supporting documentation to assist with their claim. So again, other affected veterans and survivors. So under the PACT Act, survivors may be eligible for VA benefits, including dependency and indemnity compensation and burial benefits. This is, again, va.gov slash PACT, P-A-C-T. This has all the information about this, so it's another very, very good resource for anyone to go to. This is one I also wanted to bring to your attention. I do hear about this quite a bit, is Camp Lejeune, the Justice Act, CLGA of 2022. There's a lot of advertisements out there from lawyers, law firms. I see it on TV all the time, or others seeking to represent veterans and others in liquidation related to the PACT Act. These lawyers, firms, and private parties are not connected with VA benefits or services. So I feel like sometimes that we've had a few gentlemen that I've talked to that maybe have gone through something like this. Basically, again, go directly to veteran benefit services, and they are the people to talk to about Camp Lejeune. This is another good one here. Learning more about this is under publichealth.va.gov. Again, exposures, and at Camp Lejeune, they also can call the 800 number. That's 1-800-698-2411. Again, I know these slides are being shared, so please take that. You also probably have these numbers already at your fingertips. Another one, avoiding PACT Act scams. Once anything gets going, we always have those people out there. So they've been doing a lot of what we call phishing or email scams, doing stuff on the phone, social media scams, targeting all kinds of veterans. My husband is Vietnam era veteran, and I'm always amazed at how much stuff he ends up getting either via his email and or even calls. So something definitely to be looked at. Again, your application for VA, securely going to benefits.va.gov/benefits/applying.asp. This is the best thing to do. Be cautious of companies that claim to be contacting you on behalf of the VA. Advertising VA benefits can only be attained with their help or attempt to pressure you into signing any kind of contract. We do have, obviously, the Veteran Service Organization, or VSOs. Those are the ones that will be helping. There is a VA Office of General Counsel, OGC, and that again is at va.gov, OGC apps accreditation to confirm their credentials. Don't have anyone sign a contract, obviously. Don't sign forms that are not VA generated or a blank. And lastly, and we all know this, please do not provide personal information such as your social security number to these people. When or how should I file a claim? Apply now. I cannot stress that enough. I mean, everything I've talked to when I've sat with the benefits people is, even if you feel like you have a claim out there, even if you feel like you've been denied, even if you have a supplemental claim, go ahead and file another claim. It doesn't hurt. They're going to wrap all that up and get it together. Please, if you feel like you've been denied any kind of toxic exposure related claim, have them file a supplemental claim. They're going to review it under the new law. Again, that's va.gov/PACT. And again, you can call the 1-800 number. I'm going to stop this and share one more screen. Can you see this screen? It's just a one page. This was some information that a fellow, Dustin, who works with me in public affairs, shared this morning. Again, going back to that mission, we want to screen every enrolled veteran for toxic exposures. If they would like to, again, it's happening at primary. They can request that at a primary care visit, or they can request a phone screening. They basically leave a message either in, if they would like, via email, my health, and it's vet, or they can leave a voicemail at the 720-857-2511 number. Little bit of information. Section 603, VHA must screen every enrolled veteran. And they have been doing this again since the primary care appointment since November. But I just would like to keep stressing, they really want this to be done. And the veterans can do it not only with their primary, but again, by doing it on My Healthy Vet, as far as an email or via voicemail calling. Someone will return a call within the next 24 hours for that. And I will stop sharing screen and turn it back over to you to see if there's any possible questions I can answer on this, because it can be intense.
I have a question for you.
Sure.
So I'm a veteran. I work for Compassus, of course, but I did 24 years, and I didn't realize until right this second from this meeting that when I came home from my first deployment to Afghanistan, I not to get descriptive, but I had irritable bowel syndrome.
Right.
And just from being on here and looking at all the new openings that are kind of coming up, where they're kind of seems like I feel like they're paying more attention to maybe the symptoms and signs. Well, that irritable bowel syndrome turned into diverticulitis, which I've been dealing with since 2007 when I got back. And then I just Googled, is that something that, that is claimable through the VA, which I have a claim in with the VA. I get a percentage. And then just found out that it does. It's something that's in there that's, it looks like, so yeah, this definitely kind of got my mind thinking in a little bit of a different direction, that I feel that that would be something I should definitely reach out to have a conversation with someone. And I know for a fact that it's in my records for sure. So if you had to make a recommendation to me of where I would start that and who I would call.
Yes, two things, Nathan. So have you worked through for your initial claim? Do you have like a veteran service office, or did you go directly through the veteran benefit office?
I went through a service office, which it was in at the time I retired out of Albuquerque, but that office I think is closed. But we do have a VA office here in town, and we also have like Mount Carmel is another
Yes.
supporting place here that I could go to. Is that where you
So
would recommend I start?
absolutely. So so one of the people there that's an outreach specialist, and I was trying to pull up Corey's. So first of all, I would start with the VBA because they're for the entire state of Colorado. And their number is 1-800-827-1000. The person who is in Colorado Springs that is the benefits administrator or outreach is Corey. And Corey's last name, hang on 2 seconds.
Okay.
Let's see if I've got that. It's Corey Given, Givhan.
Okay.
He works out of the Lindstrom office there in
In
Colorado
Carson?
Springs.
That's Carson, I think. Fort Carson.
Yes, it's the
Oh,
Lindstrom
no, that's the
clinic.
VA
Yeah,
office.
it's the
Yeah.
clinic.
Yeah.
Yeah,
Okay.
and he works directly out of that office.
Oh, cool. I go there all the time.
Yes, he's an awesome person. I enjoy work. I do a lot of outreach with Corey.
Oh,
Awesome
cool.
guy.
Okay. Okay, I'll do that. I'll see you.
Absolutely. Please do. I would definitely say please do a supplemental claim and get that
I've been
rolling for
suffering. I
yourself.
mean, ever since that deployment, I've had 3 or 4 colonoscopies since then. I've suffered from, lost weight because of foods I can't eat. I mean, it's just been um, bowel hell.
Well, and I'm so sorry to hear that. But yes, I know that every time I've been with Corey and or Oscar, who's here at the Denver that I do a lot with, I mean, I always say to everyone, please file a supplemental claim. It's the most
Okay.
important thing you can do and
Okay.
get that going.
Thank you for your help.
Absolutely. Thank you.
I'll let you know. I'll keep you
Okay. Sounds good.
informed on
And
how
I
it goes.
and this is Jill. I work at the VA, but Nathan, that was actually really helpful in terms of like a case study of what to do. So thank you for sharing, because I know that
Yes.
maybe wasn't your plan today, but I appreciate it just in terms of next steps.
Yes.
Yeah, for some reason it just came to my head. I'm like, oh my gosh, this started literally. I remember getting home from Afghanistan, and within a month I had to go see the doctor. So, and I know it's in my records as irritable bowel syndrome, it's just, and it hasn't really technically stopped since then, so yeah, we'll see. I don't know what that means for me, but I think it's worth at least having the conversation with someone.
Absolutely.
And Nathan, we're thankful you're here. I haven't gotten to meet you yet. So you work with Compassus and you are a
Yeah.
veteran, which is just awesome to have a veteran in this HVP group. Are you
Oh,
new
yeah.
with Compassus? Or are you just new to this meeting?
No, I've been with Compassus for about a year and a half. And Nancy Oxenhamler.
Yeah.
So her and I are constantly working on, bigger and better things that we can do to support veterans here, as well as support them through Compassus, of course. And we are working together because I live in Colorado Springs, but I go and I do a veteran meeting in Canyon City once a month with Hildebrand. It's a Hildebrand, like a senior living community there. And I do that once a month. And what we're doing is we're going to use all the visits and monthly training that I do with the veterans at that community to help Pueblo get to start moving them forward on We Support Veterans
We Honor
program.
Veterans program.
Yeah. So she told me about this meeting, and then I said, well, just send me the invite. I'll definitely get on there and check it out. So that's why I'm here through Nancy.
Well, we're grateful you are, and you're welcome anytime. We meet the first Friday of every month.
Yeah.
So
Yeah,
thank you
she's
for
gonna
Labor
keep
Day
me.
weekend.
Yeah, she's gonna keep me on the schedule. To do this meeting, I'm 100% behind it. I go to the VA all the time, and when I go to the VA here in the clinic here in the Springs, I always go into the benefits section and I go to doctors' offices, I go to senior living communities, and I see veterans all the time. What would you want me to take to them? What's new? What can I provide them? What can I hand? You have a good handout. You have, so all the stuff that she had in these slides was stuff that I'm very aware of and that I've seen over the last year or so that have come to fruition through the VA. So it's a good, yeah, I'm right on track with everything you guys are doing here. So it's awesome.
Thank you so much.
My pleasure.
Janelle, I have some questions because I'm a little simple-minded and I need things explained so so that I can explain them to others. If I'm understanding what you shared, there's like a month left for people to receive their toxic screening and be eligible to receive extra benefits related to if they're screened and it's positive.
That's a really good question, Becky. So basically what the month left is basically signing up for health care. So it's kind of a separate issue. The PACT Act will continue with screening. I don't know if I want to say indefinitely, but at this point, it's still, you basically will still be getting screened by your primary and or calling in or via your My Healthy Vet. So that's kind of a separate one issue that will continue. As far as what the other is, it's more for your health benefits. So that's where that is doing for that certain time period for those veterans that were there. Let me pull my slide back up just so I can make sure that I'm talking correctly here.
So is there only a certain window when veterans are able to sign up for health benefits through the VA and that window's closing?
It is for this certain, let me get to that. So the healthcare enrollment eligibility, okay, which is health care. So it doesn't have anything to do with benefit claims. Sorry, this kind of is a little bit all mixed in there. So health care, if you were in the following locations and time periods, they want you to enroll in VA healthcare now. The special enrollment period, which is what we're talking about for health care, okay, which is not filing a claim for these presumptive and or toxic exposure, is for post 9/11 combat veterans who separated or were discharged between September 11th of 2001 and October 1st of 2013. The enrollment is free. There are no annual costs and care may be free as well. So that is health care enrollment, which corresponds into this PACT Act, but the PACT Act is basically also for filing a claim for these new things that they also have added that possibly weren't there before, the presumptive things that were on that slide 7. Am I answering that okay for you, Becky? I mean, does that make sense?
I think so. So like a Vietnam era vet could file for make a presumptive claim if they feel
Yes.
that something's
Yes.
on there that wasn't there before.
Yes.
But they need to already have VA benefits, have their health care through the VA.
Not necessarily. Some do, some don't.
So you can make a claim whether or not you're getting benefits through the VA.
Absolutely, yes.
But if you want healthcare enrollment in the VA in your post 9/11, your window's
Right,
closing to get
right.
that. So a year from now, they couldn't get healthcare through the
They still
VA.
could, but it possibly might not be. I'm not sure of this, so don't quote me. There's a special thing that they're wanting to get those in there for getting this taken care of for their health care. So, I mean, it's not like it's going to go away, but this is a special enrollment period for that time period.
Okay, that's helpful. And I see where
and we're always talking to people about enrolling with the VA in general.
Yes.
That's the start. And that's what's confusing to me, Becky, is that they can enroll anytime to get their medical care through the VA.
Yes.
But this window is for the extra.
Yes, it's a special enrollment period for those combat veterans that they're getting and asking. So I think the key there is combat veterans.
Okay.
And it's from that September 11th of 2001 through that October 1st of 2013. So they're trying to hit that, I'll call it generation of combat soldier.
And if somebody enrolled, or if someone wasn't enrolled, they could still get a toxicity screening that enabled them to get benefits.
Yes.
And they wouldn't have to necessarily have VA benefits already or
Right.
VA healthcare.
Right. And I think how I look at it is I try to look at kind of umbrella. So there's the health benefit side, and then there's the benefit as far as claims, disability, your rating, and so forth. So it's kind of two things. And actually, we're talking two things per this also.
So you said healthcare benefits, that was helpful. Health benefits side, and then what did you name
then
the other side?
The benefit side as far as for claims, disability, and ratings. So what, like Nathan, I'll use him again. Thank you, Nathan. Nathan would be looking at the benefit side, be looking at filing a supplemental claim, looking at maybe some kind of different disability rating at that point.
And Nathan raised his hand. That was really polite of you. You can just speak up if you want to.
Yeah, so the big question for me about that whole scenario is what constitutes a combat veteran? What does that mean to me?
You know, and that's a really good point. I have to say, Nathan, I do not know what they're saying by combat veteran. I mean, that's the terminology that is being used. I believe, though, if you're calling in and or going on va.gov for PACT Act, that will explain that also.
Okay. Yeah, I'm just curious. Does I have to be shooting at someone, or what does that mean? You know,
I don't know if it was just during those time periods that they're considering that combat era for that.
okay.
But again, do not take my word, please.
Yeah, I'll definitely, I got a
information
note
on
here
that
to
in
ask
question.
them. And I'm sure that Corey, the Corey guy could
Oh,
probably,
absolutely. And he is a veteran himself.
okay.
So
Cool.
that's always helpful to me because, again, my husband served, I did not. So sometimes it's helpful to have that reference point.
Okay. Thank you.
Yes.
So I might have missed this because I had a call from my boss. Got to answer the call. I am wondering, like, for our patients on hospice who might be older,
Yes.
what is the turnaround time on the process of getting through all this? Because
good question. Thank you, Wendy. So as far as the toxic screening, and it might relate a little bit more to Agent Orange or something like that maybe they didn't have before. The toxic screening usually is within a 48-hour window. So if somebody does something as far as saying, hey, let's see if we can start the process with the screening and then move forward as far as filing a claim, that is definitely something that happens pretty quickly. Now, obviously claims, I cannot tell you how fast they try to make those. One of the things that I would, and I was looking at this, sorry, just bouncing through this because I wanted to make sure that I think the biggest thing is looking at, and I'm saying this with kindness and gentleness, is your survivors. So if they have something in place and they're going through that, this will give them that eligibility or knowing that this has been started and possibly give them also benefits that would be lasting for that. So
for the family members.
For the family members, yes.
Sure. Which I think is what our people would probably be hoping for.
Absolutely.
I mean,
yes.
Some of our hospice patients, as we all know, last a year or two. So,
right.
But then there are the survivors who are suffering from all that their family member has suffered from.
Absolutely. Definitely the va.gov again /PACT, PACT gives them that, but you definitely want to look into that. And it's something not everyone's aware of or keeps track of, is that dependency and indemnity compensation, and also burial benefits. A lot of people that I speak with are not aware that they have burial benefits either at a national cemetery, state, and or tribal. There's 155 of them across our nation that you and your spouse can be buried at basically for free. Now, if you're using outside sources, there's also things that they still give the veterans. So I think that's a little, sometimes unfortunately not utilized. I was at a meeting the other night and they said approximately 17% of veterans are what really know that they have that benefit. So there's a lot out there that are not aware that they have those benefits.
That's great. Thank you so much.
Yes.
And I'm going to jump in quick with my VA social worker hat. When we talk education and benefits for veterans, working with a veteran service officer, they're able to expedite claims for veterans that have limited life expectancy, i.e. hospice. And I want to say veterans that are 80 years and older, just based on their age, can have their applications for like aid and attendance prioritized because they are older than the younger folk, veterans. And so here's my shameless plug for working with the veteran service officer. If veterans are able, when it comes to that application process and how to get it expedited, here at the VA, we're the hospital or the doctor's office. And then the VBA, the Veterans Benefits Administration, has its own system that the hospital does not have access to. And that is a perk to the veterans and their family in navigating the very challenging benefits side of our VHA, or Veterans House.
So
My
Stephanie,
understanding,
oh,
go ahead.
I was going to say, is that that wouldn't be through the PACT government PACT program? How would they connect? Would they go to our new social worker or connect with you?
Oh, I'm going to put in the chat the State of Colorado Veteran Service List. That's for every county, but then also there's organizations like the Disabled American Veterans, other agencies too. But for rural veterans where I work, it's quicker for them to get with their local county person than it is bigger groups sometimes.
Yes, and thank you, Stephanie. Yes, that was very, very well put. Thank you.
Am I understanding correctly that so someone doesn't need to be enrolled in the VA to still have burial benefits, that they're eligible to have burial benefits whether or not they're enrolled?
Absolutely.
But they go through, if someone wanted to access that would be a great education, I think, if you have somebody that can help us, because that's really applicable to hospice.
National Cemetery Association, and I can send both you and Stephanie information on that, but that is another really awesome. I deal with the guys here at Fort Logan, and also Pikes Peak.
So somebody, because I've run into some veterans in our community and on our service at times that have some wounds that make them not want to be part of the VA, and not anything. I love the VA. You all are very accessible and teaching us a lot, but if they didn't financially have the money to cover their own burial, they could still their families could still access burial benefits. Am I understanding that correctly?
Yes. I was trying to get you.
Do their spouses have that access too? Do spouses have that same access as well?
They do. They do. I mean, your veteran has to be there to have a spouse buried there.
Oh, right. Okay. Okay.
So there are some instances where, like if your child dies first, you can request as a mom and or dad to be buried there also. So, but those are special cases on that. I was trying to find a quick number for you, which quick is the ultimate thing here.
I saw the list, but is that something, Becky, that we could have emailed to us outside the chat? I don't know how to make a copy of what came through on the chat.
Yeah, if it could be emailed to me, I can send it to everybody. The chat doesn't let you copy and paste.
Yeah.
You can click on it and it'll take you to the link from the chat, but
yeah, thank you. That would be wonderful if we could do that. And I want to put in a plug for VSOs. We work with 4 mountain communities, and I don't know what we do without our VSOs. We would just love them. So we have them on speed dial.
So
I
Becky,
did
when
just
you do
put
this,
the,
go ahead.
excuse me, I just put the NCA website. It's just under there just as a reference point. So
So Becky, to make you work, if you could maybe attach all of these with the follow, like the recording, and just have these attached as references. Because I'm a pain
Yes.
in the,
Or if they can be emailed to me, that is really helpful and a lot easier than reading them all.
and email them. Yeah, so you can all email Becky and then she can attach them to the recording, then we can share them with all our social workers.
Does that make
Sorry.
sense? Yeah, this is really helpful information.
Definitely.
I did help a veteran survivor get started with getting a cash benefit from the VA. And during the time that we were doing it, we discovered that that cash amount was increased like from $250 to like 600 and something. And she was thrilled with that. And it was a burial benefit. They did use Fort Logan as well, but it really did help her with the cost of the cremation.
And I think I want to hop in there and just point out, we have 3 branches of the VA. So we have the Veterans Health Administration, where I work, and Jill works, and Stephanie works. Then we have our Veterans Benefits, think pension, monthly income administration. And then we have our Cemetery Administration, think your burial benefits. So a lot of times I get inquiries about burial stuff, and I'm happy to provide information, but we don't authorize any of that. We provide healthcare. So somebody does not have to be registered or enrolled or have a primary care doctor or any of that to explore their other options. And that is burial benefits is definitely on the list for us to have a future education on. Yeah.
What were those 3 administrations? The healthcare, cemetery, and what was the third one?
The VBA, the Veterans Benefits Administration, think money, think income.
And just to kind of in summary, this has been a lot of information. Thank you so much for your time, Janelle. I'm sure that a lot of our social worker teams especially will benefit from this. Could you summarize how, if we have a patient, since we are all hospice partners, a lot of us I think also might have palliative patients at times, and they come on service and they have one of those listed conditions, and we know they're a veteran and they served during that, the time that they served is correlates. Our next step would be to support them. If they didn't have support, our next step would be, can you fill in the blank just for a summary?
So thank you, Becky. I guess as a summary, I would definitely say the first thing to make sure is that they had toxic exposure screening. Again, that's that 5 to 10 minute. It's very quick. They possibly might have had it at a primary. That might be something that a family member knows at this point, if that's included in their file. If they've even heard about the PACT Act, maybe would be the first start point, and then dates, and then going to the toxic screening, and then probably saying, okay, let's do an intent to file and do a supplement if they already have a claim, a primary in place. And definitely reach out to the VBA, the number that I gave to Nathan, and or to your VSO, whoever they might be using, their veteran service officer, be it a county, be it like was mentioned, Disabled American Veterans, American Legion has it, the VFW have representatives, so any of those sources.
Thank you.
Thank you.
So I have one more question, sorry. I know the answer, but I have to ask it anyway. None of these benefits go towards any of our officers, like firemen, policemen, that sort of group? unless they
Well,
were a veteran in the military.
Exactly, Wendy. I mean, so they would be a veteran, which like here in Aurora, we've been reaching out to the Aurora Police Department, and approximately 30% of the force of like 680 people have served in the military. It's approximately the same for the Aurora Fire Department. So you can usually kind of estimate 20 to 30% probably of any, EMT, fire, police, they're usually going to be around that percentage for military veterans.
All right, so just reaching out and saying, hey,
Yes.
okay.
And we've been
Okay.
trying to get this word out as much as possible to those organizations.
Wonderful. Okay.
I guess that's our last question then maybe is how can we support you in getting the word out? How can we be a part of this with you?
I would say that probably that PACT Act overview is one really good one. I also have another sheet that I will send over that basically gives a little bit of information just here for Colorado as far as kind of the toxic exposure screening. That's the key is probably really making sure that people have had that in some shape or form and that they are aware of this act and filing a, again, primary or supplemental claim. So it's just kind of talking about the PACT Act in a general sense, and then being able to give that information further to either the veteran and or their family member.
Thank you.
Welcome.
Any other questions or? This was really helpful. Thank you, Janelle, for sharing your time, and for Wendy this was, I think, Wendy's idea a little while ago, and getting all this together. Really appreciate it.
Thank you. I appreciate
Stephanie
you.
backing us up. Yay.
Well, and nice to meet you, Nathan.
My pleasure.
Becky, is there any housekeeping business that we need to tend to before with the last 7 minutes or after this recording?
Well, I sent you an email right before this started, so I don't know if you even got to see it yet, but we don't know what October's education is. And so I was just saying, I talked with Laura earlier. Was it the beginning of this week or the end of last week? I don't know. It was not too long ago. And
Laura Madeline, yes.
Laura Madeline. And Stephanie, you had mentioned perhaps talking about the rural program that you do in telehealth. And so right now it's open for October, and I have a couple other things on the list, but if either what we talked about, Laura Madeline with the dementia was available, or Stephanie, you were ready with Jill to present. I think Dennis was about to talk too. He unmuted, so.
No, that's okay. I was just going to say that I'm still working on the Wounded Warriors project to see if they're willing to come and present to us, given that they're in their 20th anniversary coming up. So I just sent them another communication today. So if I hear from them anytime soon, then they may be an option for October. If not, then it'll be for, obviously a little bit later. So.
Thank you for doing that, Dennis. I know you've copied me. You've been diligent on your side.
Just let's hope I can get them engaged with that, or to see if there's other opportunities for us to engage them, given that they're going to be going through a major celebration year. But more to come.
Yeah, if there's something we can do collaboratively, that'd be awesome.
And then, I'm sorry, I was going to say also, I think it's a ways out, but the Vietnam Veterans Memorial Day, like the March 30th. I don't know if we want to ever talk about anything or joining on anything with that.
Collaborative for that as well.
Becky, Jill, and I can present